Can somebody give me an amen up in this joint? Welcome back to Calling All Beings. I'm your host, DJ.
And I'm Boston Bia. I'm coming to you from Aruba.
Can somebody give me an amen for that? Somebody get a vacation and it's not me.
Nope.
Good evening, everybody. It looks like we've got just the small crew in here, but it'll, people see that we on and then they'll want to get up in this joint. So look at that. We could put it up on stage right there, can't we? You can see, where's the comments? It should be, why is it not working, mate? I don't know. Anyway, see, you haven't heard that accent before, have you?
Mm-mm.
See? Always got a surprise. There it is. Now we got it. Hello, Debbie Blah. And AKA the cat lady who done made this thing happen. We got an ICU trauma nurse, and God knows my knees had some damn trauma. Self-induced.
Yep.
Jules is here, the original gangster and dragonfly. So all right. So we have to thank the cat lady. We're able to get this young lady. I am going to bring up on screen a bit later the photos that she. I'm gonna have to find her other email. The photos that. Oh, there they go. Okay, the photos that she sent me. Why are they not opening? So yeah, I may have to rework to open those, but they are photos of the brain and things like that, things that we don't understand, but she does because she was a trauma ICU nurse. And she also went to a lot of these sort of conventions where the doctors would go and said, you know what, mate, if the doctor can go, I can go too and learn this stuff, mate. Do you know what I'm talking about? All right. Without further ado, party people, get those damn hands together for a homegirl from Detroit, Michigan. Put them together for Andrea Pfeifer.
Hello, everybody.
Good evening, Andrea.
Calling all beings. We're here.
Yes.
This is the joint. Look at it. There was another round of applause just because she said calling all beings. Can you believe that?
I love you guys. Bia, you are a doll.
Oh, thank you.
And I love your accent. DJ, you'd fit right in with the family. My kids and I, you never know what day we're going to be, like Southern, British, Irish. We flip in the car. Just
flip it around.
Yeah.
Oh, we can switch it to Irish at any moment you want. I can talk Irish if you want to, but why bring out the Irish this early in the show when we don't even have anybody Irish in the chat? And oh my God, look who's there. It's Scott McGinnis. One of the boots on the ground, for Christ's sakes.
I see Scott in all the chats. I love and respect that man so much. Carrying the flag for all of us. Thank you. Thank you.
He is. And look who's here. Brian's Frozen Donuts. Because who the hell isn't going to go buy frozen donuts for an adult in the middle of a blizzard? I mean,
and you know, I forgot my readers, so I'm going to look like our wonderful Nan Gallagher, who's going to be doing the close-up. Okay.
Nan Gallagher. Yep. We're going to see Nan on Sunday night for the Mike Crawford benefit that we're doing in order to try to help whatever legal challenges that he's had. We want to try to help if we can and raise some money. So as long, why aren't these photos opening? This is terrible. They're not opening.
Mr. Sweeney's in the house. Hi, handsome.
Oh, Dennis
Mr. Sweeney. We're honored with Dennis. Oh my gosh.
Let me tell you something.
All the names I've looked at for 2 years online. I feel like I'm in with all these famous people.
Yeah, you
Literally.
are. You are with Dennis. It's like you have to pay. You have to super chat Dennis to come on. That's kind of. That's
Okay.
kind of. Oh, I've
My
got some
friend brought
photos.
me some readers. Let me see.
Oh, I've
Wow,
got
Judy,
photos.
what's your script? Okay. Okay, I can see. All right.
I've got photos, so we're going to be able to show some stuff. So if you would briefly explain to our audience, Andrea, what your background is and why you're here today.
Well, I got involved
Hey, Mark.
in the Karen Reed case. I heard about it like everybody else and thought, oh, too bad. Drinking sucks when you're driving and something bad happens. It's awful, right? And then time went on and I heard there was some kerfuffle about the case. And because I took an interest in forensics, being a trauma nurse in Detroit for over 20 years, worked with FBI, DEA, ATF, lots of trauma surgeons. We did brain surgery at the bedside, and not like Dr. Wolf brain surgery. We did open craniotomy brain surgery emergencies at the bedside. Anyway, I started to look at the autopsy photos, and like most people, it was like, oh, heck no. But I went to my 60-inch screen and did the kind of thing I did with a deep dive, and including getting into what is vitriol blood alcohol content would have been extrapolated back the 2 days, not just the 0.28 it was. So I got into it from there, and I just thought, wow. And then when I learned more through Aiden and what all the people have been doing, the boots on the ground, I thought, oh, no way, no way. And I've seen a lot of people in shock say things for like a day or two, convincing themselves that this trauma was their fault. So I've seen Karens, and I've seen them try and make sense of of what they can't.
Right. What happened? Was I responsible? All that neat stuff.
Yep. Absolutely. Absolutely.
Yeah. It's you're, I mean, go ahead, Bia. I mean, you're in a state of panic, right? You've seen this.
Right.
It's horrific, isn't it? You guys, have you seen people in shock like that? You know, they just, it's not good.
Yeah. They don't know how to make sense of what happened, and they're looking for an answer, even if it's that, saying, did I do something? I mean, you would naturally do that. It'd be like, you're having a wrestling match with someone, and you're just going through normal moves on the wrestling mat, and then all of a sudden, that person, has convulsions, and you're like, wait, did I do something? And you're like, well, no, I didn't do anything. I was just doing, the normal wrestling practice. And so those types of things, that's kind of like, but you're going to be freaking out. You're going to see maybe a teammate and maybe a best friend that's in distress, and wonder if you had something to do with it.
And there's some nefarious things going on as far as Brian Albert, Higgins, Brian Albert with his background with MMA, boxing. I didn't watch Boston's Finest, but if he's the head of a fugitive unit, the man's going to know about cerebral spinal fluid and leakage from the ear and nose. Okay. So let's say the Commonwealth's theory is not accurate. Okay. Because as far as I know, polycarbonate in all my years and all the bodies I've seen hit auto pedestrians, they've never come in with a pattern of parallel injuries on an arm, with punctate wounds, with a dog that's going to bite with the front part of their mouth, literally because they're nervous to do it, but they're going to do it. Like, I don't want to do it, but I'm going to do it. He wasn't known to the homeowner. But you know who would know leaking CSF out the ear and nose? Brian, the Higgins and Albert.
Of course.
So that's what first started me going. And a lot of times, I hate to say this, murderers would, and accomplices with my gangbanging patients that would be in there, shot, stabbed, beaten, what have you. A lot of the visitors I knew were participants in why my patient was laying there unconscious, because they asked way too many times and zealously, You think they're going to live? You think they're going to live?
Right.
So, and I had an inherent thing for body language, I think, and noticing behaviors for two reasons. One, waitressing 5 years through nursing school, you learn people's behaviors,
Right.
cues,
Right.
right?
You've served everybody, right?
So some people like to eat alone and they give off that vibe.
Yeah,
You can
they don't
tell
want to be talked to, and yeah.
a couple that's in a fight, they give off a vibe. A couple that is in a fight and wants you to save them, they want you to entertain them at the table, right? So, and I mean entertain them in a nice way, chatting or whatever. So I learned a lot about behaviors. And then when I started studying the brain and finding out that the occipital lobe, if an unconscious patient looks upward, then I started studying body language. Then I made best friends with a librarian who was very upset with the neurosurgeons because these books were $1,700 a piece and the neurosurgeons weren't using them. I said, do you mind if I do? So I started taking them home. And then I'd have all these unconscious patients and I'd be like, did you see this coming? They couldn't talk to me. They were Jane Does, John Does. So I started looking for tooth marks. Writer's bumps are disappearing. I could tell right and left-handed people by writer's bumps.
Yep. Well,
Male men and teachers, terrible feet. You know, literally, you could tell these things.
Wait,
So,
I just want to say I have great feet because I do a lot of barefooting. So I want to say that I'm a departure from the norm, and I'd be happy to take photos of my feet and have you evaluate them for the audience. Okay.
there you go. Any day. Mine
This ain't that
up.
type of show. I'm just kidding.
Right.
Hey, I just want to
years
say
of dancing, but I used to say dancing, and my friend from high school that's still friends with me, we're like buddies. He said, Andy, you can't go around saying you were a dancer. They're going to think you were like a dancer.
Your word, DJ.
Yeah. And I said, okay, I have to start saying ballet, jazz, tap toe. So old Arthur took me off the job. So I am retired. I'm not an expert witness. My ex-husband was a criminal defense attorney. And so through him, I did a lot of consulting, helping his friends devise questions for neurosurgeons and stuff for free. Now in hindsight, I'm like, what was I thinking? And then I started going to forensic conferences, which were like $250, $350 a day, which was a lot of money compared to the CEUs a nurse could make for $30 to $50. But it was because I was really, and slide after slide of a dead body and suicide or this or that, entry wound, exit wound. So I've literally seen hundreds of bodies. I have not participated in autopsies. I don't think I want to be around that formaldehyde. If you remember the guy they had at the last trial for the defense, do you remember him?
I'm so sorry. These guys are going on about the foot stuff. It's just kidding. And like,
I can't see the comments. That's funny.
Yes, you can. You can.
Show us your feet. Go on OnlyFans with your feet.
Yeah, you should be able to. I don't know.
I'll clutch my pearls.
Oh my gosh.
Okay. No,
I've got my pearls.
That was not where this was supposed to go, Coco. This was just saying that my feet are healthy. My toes are not squeezed together with a bunion sticking in and all that. People's feet will kind of be, especially women's feet when they wear, a lot of heels and tight shoes that smash their feet together.
Well, no one's suggesting that you were wearing women's shoes.
They can get ugly.
Men do it. Cowboy boots will do this. If you're wearing cowboy boots and cowboy boots are the least healthy thing you can wear for your feet, as cool as they look. I know this is ridiculous. All right, let me ask you. I want to ask you,
like, what happened to the chat?
I'm gonna try to rein us back into the show because this was an inadvertent departure into.
It's all right. We all, with all this craziness, DJ, we need a little laughter.
We do.
We need some comedic relief. And
we need a Bigfoot episode. This is why we need another Bigfoot episode.
I knew he was going to bring up Bigfoot or a UFO. I knew it. He's going to do it.
Well, I mean, come on, man.
Why not?
The UP is huge for Bigfoot. There's Bigfoot. Michigan Rob has a huge YouTube.
I love the UP. It's so beautiful up there. We went up there for our honeymoon. It was gorgeous.
That's what I hear. It's just a natural wonder. I've never had the pleasure But let me ask you something. I'm barefoot mostly. Exactly. You probably got healthy feet. Soulmate.
B is like, I never knew this, and I don't know if I needed to.
TMI.
Okay. All right, Coco. All right. So, thank you. We love you, Swiss Miss. All right. Let's
You guys are funny. This
every
is
trope,
hilarious.
every trope that's to do with the feet, we're gonna get now. All right.
Oh yeah.
I want to rein this back in. And because that you worked as an in trauma, did you work ER? Because before we get into the brain, I wanted to talk about the injuries to the arm, and if you have, did you work ER, and were you? Sorry, this has gotten out of control. Arch rival.
Yes, I did.
Coco, you are going to be on our next listener roundtable.
Yes.
Based on this show, unless you wuss out. Because we had other guests that said, "Oh, I want to be on a guest roundtable," and then they wussed out. All right,
Arch is higher.
Yeah. All right. All right. Andre, let's try to.
I'm sorry.
We're gonna
wheel it back.
I have a warped sense of humor. Nurses and policemen and paramedics and stuff and service people, we can get a warped sense of humor. We really can.
Yeah.
You know, I can tell you a story. Now I'm going to break the ice. I'm going to tell you this. And DJ said, don't tell a story. I'll lose the audience. I got to tell you guys this.
Sure.
I've got a guy who's just waking up. He'd been shot like 3 or 4 times. He was about 24, handsome. And I was like, oh, I'm so glad he's going to make it. And we were just getting ready to get him off the ventilator. He was on a ventilator. Now, this is an ICU, not the ER part. And we were just trying agency nursing, where you rent a nurse out and an agency gets paid like a few hundred and she gets like 16 hours. This is in the older days. And she was an agency nurse, so I didn't know her that well. So somebody covered his exit wound on his back, unbeknownst to me, with a 2x2. Now, they're like dog bites. You don't cover dirty wounds. You just don't. Now, I saw the date on the thing, and it had been 2 days. So I was like, and I noticed a little bit of a raised area on his back, and I ripped it off, and I was like, I saw the initials of who it was, and if it was someone I trained or not. They're going to get a little bit of a little nif-naw, which is UP for a little chat, Indian language, little nif-naw for doing that. You don't do that. So I go to hold the patient on his side. He's on a ventilator. He can't talk. And all of a sudden, I see this nurse that I just met with a dark, rusty fluid with a smell squirting her like a fire hose. And she's going, and it's going in her mouth and eyes. And I'm thinking, what's happening? My fingers, like say this was the exit wound, went on either side of what ended up being an abscess. And I compressed the abscess right into her face.
Oh,
wow.
Across the bed and into the curtains. And guess who walks up to visit him? The family. And guess who loses it with a maniacal, out of control laugh? Me and the girl. Now they're like not like happy that he's been shot in the first place. He's in ICU on life support. And we're in there. I am crying. I'm telling him, you'll feel better in a minute. He starts coughing, laughing. And the alarm goes off. My manager walks to the curtain, opens it. When this girl turned, she looked like she'd been in Carrie. I'll never forget it.
That's a 70s movie where, she was covered in pig's blood, I think.
Well, is this too gross for you guys? Is this too?
No, I'm good. I'm fine.
Are you guys? Is anyone fainting? Am I losing anyone?
Not yet.
I don't need a ventilator or anything yet.
Yeah. So
C-Star. Hi. Oh wait.
So she had to go shower, but we could not see each other for like 3 months without crying, laughing. Like we couldn't even face each other. Like we couldn't even talk. It was that bad because it was so unprofessional. We couldn't stop.
Not all heroes wear
Thank
capes,
you.
talking about nurses.
But when they came in to clear the abscess, we had done it effectively because after that, I did it under controlled circumstances. And the surgeon thanked me. I said, "You're welcome." And then I did talk to the nursing staff that was responsible for covering it, because sometimes you just get so stuck up with not wanting the bloody bed and covering the oozy wounds that they're not thinking, it's like, you don't do that, What have I taught you?
Thank you, Jay.
I used to call them my little lambs. I'm like, so anyway, yeah. But
so let's go back to dog wounds. And I want to know, because I can say, I think that looks like a dog wound on John's arm. Bia can say that, we're laypersons. We don't know. But have you worked in the ER? Have you seen a number of dog bite wounds? Does that look consistent, or does that look like it could have been something else to you?
Okay. Do you think dog packs roam in Detroit especially when it was the murder capital of the world? Answer to that is a big yes.
Mm-hmm.
So, and I never thought to count,
mm-hmm.
but a lot of our street people, and I love them dearly. Some of them are my favorite patients. Some prostitutes, drug addicts.
Sure.
They became my favorite patients, and I tried helping them in any way I could, even financially. I got that involved.
That's
I
awesome.
didn't get married till I was 35 because I was all about work and I loved what I did. So I just would see them get attacked because a lot of times they would try befriending dogs after, say, PCP, which wasn't a good mix, and they'd get attacked. And usually it was, I'll call the hairy parts of the body to make it easy. But there's a ventral part of the body where we don't get as much sun and the skin is thinner, like this side of the arm.
Sure.
And a dorsal part of the body where we tan and are hairy. If any animal attacks, it's natural to brace and fight with one limb, which is another thing that Garrett Wing may touch on, if he's allowed to, is sticking one limb out while trying to protect arteries are here. You don't even think about it. You just do it.
Yeah, you're just like you protecting your core, just like your body does when you're when you're going to be hypothermic, all the blood leaves your extremities and goes to protect the part that's keeping you alive.
This isn't using the outer cortex gray matter of the brain, which is your sympathetic nervous system, like your rational part of your brain that says, I would never do that. Oh, well, if I want to have fun, I do that. This is the autonomic nervous system that blinks, breathes, protects yourself on falls, unlike Collins falls on his knuckle.
On his knuckles, everybody does that.
No,
it's not normal.
The sympathetic nervous system wouldn't allow for him to do that. It's against the grain. He would have had to have been duct taped to not try and open his hand without thinking.
So,
yes,
but does that?
So
the question was, does that look consistent with dog bites to you, or do you think that in your professional opinion, that could be something else?
No, it can't be. It can't be glass, and it can't be polycarbonate.
Why not?
It's very consistent. I'll tell you about that. It cannot be polycarbonate, and it can't be glass because they leave different patterns of explosiveness. Okay.
It's too linear. Is that?
Oh yeah, it's too parallel, and that's why this blue paint thing doesn't work, because they would have to be in the same direction all the way down in the bent arm theory, and they're in the same direction all the way on a straight arm. You know what I mean? His arm in the paint experiment went perpendicular to itself. We're talking about an arm that was just vertical, that was getting attacked by a dog, and he pulled up where you see deeper wounds. You see the lower canines and punctate wounds, which are tiny bruises. They're tiny bruises. They're like boom, boom, boom. You saw the teeny dots. Those are called punctate. So ecchymosis is bruise, ECCHY.
Basically,
And
Ashley's saying here, I was bitten on the bottom of my leg by an adult German Shepherd 7 years ago while walking my dog. It was loose and tried attacking my dog. 100%. She probably, if she had a small dog, she would have lifted that dog up. 100% dog bites and OJO. I
did she
agree
have
with that,
pants
but
on? Did Ashley have on pants? And
Ashley,
did she see the exit wound or the exit wound to the material, shall I say? Because I also sew. So I noticed fibers. And these were all things I was trained to notice with forensics coming into nursing and emergency rooms, and not to put things on the floor. You know what I'm saying? To be careful with the evidence, not to start at the bullet hole and start using your medical scissors to cut up.
Mhm.
So, yes, it is very consistent. I'd say beyond a medical certainty, like Dr. Russell is going to be using her scientific method, but I am very certain that was from a dog, especially when I saw the sleeve and the loop pattern of the canine exit. Now, what's with this plexiglass hoodie being placed in plexiglass so they aren't going to be able to see? But I know the defense has photos for Dr. Russell showing the loops.
And they're very close-up photos, too.
Right. And so hopefully somebody knows about material on that, jury.
Basically,
And palm of hand without thinking.
People will fall. And,
yep.
Yeah, you've had that black, with black top, it'll scrape your hands and cut your hands, and you'll have embed of the black top if it happens on a black top in your hand. I mean, your hands will not be feeling good for several days, or at least a couple of days, I would say, after that. So yeah, he didn't fall on his. I mean, everything that these guys have said, every excuse that they have for why they did, the behavior that's not normative, rehoming your dog, why you then had your basement all of a sudden redone, why you sold your home, why you got rid of your phone on a particular day and wiped it, and then your counterpart who was at the house also disposed of his phone in a very unusual manner, when most of us go to the fucking iPhone store and go, here, I deleted the iCloud and here, and you hand it to them and they take it. But they knew that the police would have gone there and got that phone.
They knew all that, but they also knew about the CSF. And I think they tried sitting him up because he was out immediately. There was no toggling, nothing. The base of the skull, and in any of the pictures you might want to show on my X today, right before I came, there's a bottom view of a skull, the lower third. Okay, there's planes. The bottom view on my X, and I'm not trying to drive traffic to X because I'm off it after this.
No. You can more than we will promo your X in the show notes. So don't worry.
I'm not in for. I'm not in it for that. I want justice, but the bottom of the skull that spread all this, there's a circle of Willis, which is very important for all the vessels. 20% of the blood flow comes from the vertebral artery in the back of the brain. You cannot tell me this man who lost allegedly 3 liters of blood, not 3 pints. A pint is about a third of a liter, okay? So people are getting their pints and liters mixed up here when I see chats. So he lost, the normal individual. Am I yelling? Am I loud? Anybody?
No, the cat lady was just telling me we may show some photos, so I'm glad she reminded me to announce that. Okay. If someone looking at John's injuries might be triggering to something.
Right, exactly. And that's why I'm saying if you want, go to the X, and I'm not advertising anything.
Yeah.
I'm just a regular mom.
Yeah.
And I was a soccer mom, but anyway. So the bottom third got cracked at the back, and Dr. Stonebridge and Dr. Scorty Bello, neither would opine the power of the force that caused the crack. Whether the crack came from falling backwards, they both said it can occur. They also both acknowledged it can occur from getting hit from something. And ironically, looking more closely now with the J imprint, I have a son who's built like John Cena, but he's steroid free. Okay.
Good to know.
Works out every day.
So do I,
when
but I
I
don't look like
showed
John
him
Cena. Just
that,
kidding.
I said, I'm not a John Cena fan.
I'm kidding. I'm
myself.
kidding. I'm kidding. Go ahead.
I can't watch, and I don't want to offend anybody. I can't watch the wrestling stuff because of what I saw to happen to brains with one punches.
Right.
I wrote to you about that one punch. But anyway, I can't watch it because it just, when I saw what it did to actual brains and people's futures, I can't watch even entertainment. I think it's maybe a PTSD thing for me. Like, it's like too many kids, and everything. Well, anyway, where was I going with it? So the bottom third gets fractured, goes toward the front. But I will tell you, this man was struck 3 to 4 times. The floor of the orbits were also fractured. And I put that picture, it's the one that's been in evidence, white with the green highlighter. If you checked my ex, which is Andy's school.
Let me see. I'm going to go on this page right here and scroll.
Those where the fractures were.
Do you want to start?
That's where he herniated. Now, that's not his brain.
Okay.
But the lower third of his brain had nowhere to go because of all the circle of Willis in the middle near the ponds.
Right here?
I know you guys know lower. That's a ventricle. That's fluid. Every hour, we make 15 to 24 cc's of nutrients for our brain from a structure called the choroid plexus. But I won't do that to you. So, but in a day, we make about 400 cc's, and we have 4 spots for that fluid to go.
Well, guide me to where the area that you're talking about.
Everything swelled so much that it became a tonsillar herniation into the hole that the spinal cord goes up.
Right here?
Yes, called the foramen magnum.
Okay.
Now, you guys have heard that whole name before, probably. Foramen magnum. And the guy that named it literally named it after himself, Magnum. So the brain will go to the path of least resistance. Another path of least resistance when it's swelling are behind the eyes, because literally the eyes are part of the brain.
Right,
so you get swelling.
Right here.
But what I want to bring up to you, what's missing from these reports are bruising behind the ears, which are very, very big with raccoon eyes and basilar skull fractures without a beating. So I'm telling you, have you heard anybody mention bruising behind the ears right here on any of the autopsy stuff?
I've
Nobody.
not, mate. I've not.
So because there's no mentioning of the bruising behind the ears, and he did have a basilar skull fracture, and the left eye eventually caught up with the right eye, he took a strike to that right eye with a punch. My belief is that he was holding the full glass of fluid he took from Karen's vehicle, tall. And if you know about physics, when something drops on a hard surface, it tends to return in the direction from whence it came. Does that make sense?
Yes, like it bounces off the earth. Is that what you mean?
Yeah, it will bounce and fall, but it will also kind of go back, even if you dropped it at an angle, like not just flat, kind of at an angle, it would come back up. Possibly, I believe a shard of glass could have gone in his eyelid. Now, Buchanan said that was a very small wound, tiny, tiny. That was a 7 millimeter cut. Think about how large an eyelid is.
Yeah.
Let me see. I brought my ruler. If I can find it, I'll look. But 7 millimeters, if you think of a male eyelid, measure your eyelid.
Yeah.
That's a significant cut.
Yes.
So it can happen 2 ways. Either from such fast swelling that occurs from a punch, periorbital, in other words, around the orbit, but his was below the eyebrow, and it was still dripping in the hospital in the autopsy photos. So I think that could have come from the glass as well as the shard of the left nair. I do believe Dr. Scortibello was thorough because she included that abrasion. She included that. And I love how she held her ground despite being called all the way through April, January 29th through April. She did it 2 days later on a Monday, I think it was the 31st, did the autopsy. That woman was pressured for 2.5, 3 months to say something. So all she gave them was something about it not being from a fight. She was being bullied. That wasn't her normal home-based office. They were used to having a relationship with another ME.
I have to assume, based on a recent podcast that I've heard about your neighboring state in Illinois and Chicago, that this happens all the time, that they will strong arm firefighters or ambulance personnel to come to a certain conclusion, to write something in a report. And it clearly from the conversation, the text messages, they've done that with MEs before. That's why they said, did you already go see the ME? And he goes, rookie.
Yep.
So,
yep. Now, in this picture, you see frontal lobe, ethmoid, sphenoid, temporal, parietal, occipital. Okay. So his frontal lobe had bleeding. His temporal lobes had bleeding.
And where's that now in here?
Side
my
temples.
Mouse. Where's it? Okay, so right over here. Or you can't see my mouse, can you? No.
Oh yeah, I can. Okay, yeah,
we can.
Go up toward the green, where it meets with the yellow. There. Okay.
Right here.
Temporal. Blood more on the left. Why? He had an injury mid back on his scalp, right?
Mm-hmm.
Now they said it was a little to the right in
well, we can go look and then you can talk us through it.
This we can go to the green, go where it shows blood. Go back,
okay.
Go back up to show where it was there. Go back up.
How about this one work? No?
No, that's the one we were just on. Up to up. Right there. There. Okay. Dr. Wolf said this was coup contra coup. I'm going to disagree, God help me, with a summa cum laude graduate from Lyon, because he was struck and he had, these are fractures in the back of his skull. Even though there's a little bit to the right, it doesn't mean that there's a direct path to the left orbit. Coup contra coup. Coup is the initial injury where you can get a bruise.
Mm-hmm.
Contra, sometimes you don't get a bruise where you get hit. Contra, you can sometimes have a bruise on that part of the brain. But it's usually a direct line, DJ. It's usually a direct line. These aren't direct lines. I believe there were 3 or 4 strikes to this man's head. Mm-hmm. I think the last one was the fatal back. Now, my son who does the weightlifting, when he saw the J mark on the left side of the laceration on the back of his head.
Should we go to that? So if you
want, if your audience is okay with it.
Yeah. So everybody, if this is bothersome to you, we understand.
And I can address the socks. Okay. Up right here. If you can enlarge it on our left, there's a J imprint.
It doesn't look like I can.
Okay.
I'm trying.
I'm going to ask you a question. Do you see ice cubes in his hair? Do you see any icicles?
I see something that's wet, like right here, and I see
that could be blood.
It could be. I don't know what it is. No, I don't.
Why isn't there more blood?
Because it's all in the basement.
There's no documentation of washing tons of blood.
Right.
A head wound can ensanguinate a human body within 3 to 6 hours, like that. We have 4 to 6 liters run through us, our heart, per hour. The average body has 6 to 7 liters, a man of his size. He would have exsanguinated all of his blood. He did not. When he got to the hospital, he still had blood volume. When they put the Lucas machine on him, he was still able to bleed from wounds at the fast rate because we were pumping the heart, right?
Yep.
They called him deceased at 7:50 a.m.
7:58 a.m. Wow.
No, 7:50. It was
7:50. Okay.
My trigeminal neuralgia expander that made me speak. But my son pointed out he thinks that is from something that he didn't know about weights in the basement. He looked at that and he said, was he around weights? I said, why are you asking?
That's interesting.
And he said, that looks like what a plate would go on. And there's a hook that goes, And if he fell backwards, it would leave that impression.
Yeah,
I
the
said,
the hook on the squat rack that
that's what he
holds
was
the
talking
bar,
about.
those little J hooks that hold the bar, it could have been that. So I'm totally open
It's a possibility. It's
to
just a
that possibility. I just
Now-
don't know why. I postulate if they punched him in the face and he fell back and hit his head, I don't know why they didn't just call 911, because it would have been an accident.
Because the dog attacked and someone punched him.
Yeah, but that's okay.
So it
But-
would have
but
been
you would-
manslaughter for somebody, and the homeowners insurance. They panicked. They were drunk.
Yeah, well, that was part of it. Being drunk. You're a poor decision maker. All of us are poor decision makers when we're drunk. However, if it was a simple, I punched him in the face and he fell, they could have rendered aid, called 911, and it all could have been explained.
But then the dog was
let me finish this real quick. If O'Keefe is going to tell a different story than what they told, like let's say, oh, he just fell, and O'Keefe said, I didn't fall, someone hit me from behind, now we have something that's a crime. So that is why when they made the decision, because you're a brother officer, you're both at Boston PD, you're not going to call. I mean, Brian's going to have to call into work and tell him O'Keefe got hurt. He's going to have to call the desk sergeant and be on a recorded line and tell him, hey, O'Keefe is hurt. He's on the way to the ER. He's not going to be into work tomorrow. He's not going to be into work Monday. Right? So for them not to do that, the only reason I can think of they would not have rendered aid to O'Keefe if he just fell and hit his head is if somebody purposely struck him, and if O'Keefe woke up, so to speak, he would tell a different story to officials than what Brian wanted to tell.
I think they knew that because something nefarious occurred surrounding the injuries. We don't know if the dog started it, if the dog didn't know him and just was like,
but it's not criminal.
Shepherds, I've had German Shepherds.
But
German
it's not
Shepherds
criminal.
Don't like drinking.
No, I got it, but it's not criminal.
They saw CSF and they knew the dog attacked.
Yeah, that's not criminal.
And I do believe there were some shenanigans they felt they needed to hide. Thus, the strange behavior going to the CPD. Thus, these other things going on. It's very
it's
odd
hiding
behavior that followed up.
Yeah. In other words, they made a calculation that if O'Keefe lives, he's going to tell officials something different than what we're going to tell.
Because they didn't know how fatal that was. I could tell how fatal that was.
Well, maybe not, but there's a nurse in the house. And anyway, it doesn't matter how fatal it was or wasn't. When you see him bleeding, you call 911. If it's just a couple guys fighting, you call 911. The only reason you don't call 911 is if a crime has occurred that they don't feel like they can explain, or that O'Keefe is going to say something different. Does that make sense?
Yep. And these are
a dog
things,
bite. You could explain a dog bite. My dog bit him. I mean,
but
that's
if
not
they feel they're the cause of the assault that could lead to death, and I'm saying Brian Albert and Higgins would know what CSF means, they'd know he'd be effed up and they'd be sued big time. They know if you see CSF in a wound, that person's going to have a little bit of retardation. I'm just telling you.
That's a very important point.
So there's that. And then the wound above the head, the scabbing. If you feel your heads, we have a flat part. Okay.
Yep.
That's the flat part. Okay.
Mm-hmm.
When people get hit by cars, which I've seen tons of times on tar roads, cement roads, grass, whatever, there's a transfer of whatever they fell on, landed on, skidded in, into their skin. There just is. So there's nary a grass blade, even frozen or not. There's no documentation of any earthen materials. Okay. No earth-like materials were documented.
That's interesting.
And his hair wasn't frozen. It would have been frozen with red, rusty blood, dark colored.
Yeah, for 5 hours? Yeah, I would think so.
Even after 15 minutes, DJ, we get patients that get shot all the way to the doors. And then the gangbangers would keep going, okay? In the snow in Michigan. So within 15 minutes, that bright red blood becomes rust. So another thing I want to let people know, the bright red blood that they got in the solo cups, I believe is obviously from the left nostril where she pulled the shard from. Wow. It was fresh bleeding. He had compressions being done. They put the Lucas machine on him inside. Okay. And that was too bright red to have been there prior to that. If he was put out at 3 a.m. or 5 a.m, he still would have had blood draining from his head because his heart was still pumping. He was what's called Cushing's triad, which happens when the brain is herniating, like that side view you showed in the black and white. Okay. Oh. When the brain goes into that position and it starts to herniate into the foramen magnum, your blood pressure elevates, your heart rate goes all over, and it's called the Cushing's triad. You have no locus of control. You wouldn't be able to toggle anything off. You're out. You're down for the count. Right. And you do a thing called C's, decorticate cerebrating. If you see someone doing this rhythmically, you're like, oh God, this family, I can't, I feel so bad. This person's gonna be different forever. Yeah. Worse is to cerebrate posturing when they just automatically are doing this. Because if you hold their eyes open and you say, move your eyes to the left or right, they can't. You usually see blown pupils or pinpoint, depending. So, and the fact that he had subarachnoid hemorrhage, his leptomeningeal layers were bleeding, worse on the left than the right. Eye wound on the right swells up first. We have a glass in play that we know about that landed, and I believe the trajectory came back from the direction it came. Now, we can get some physics guys on here, like to discuss that. That's what I believe, because I would see this. Now, I would hear recipient witnesses discussing what happened to my patients as I'm caring for them. And I'd say, you can stay as long as you don't get in the way. I tried to be as nice as I could about things like that. You know, like as long as you're not going to faint on me, I need to concentrate on one person. Socks. Do you guys want me to address what happened to the socks? Yeah. Okay. Everyone's like, they're on backwards, they're askew, they're this, they're that. One thing somebody would have done on scene in the rig or at the hospital would be during the Lucas machine and during compressions, are we doing a good enough job to bring about pulses in the top of the foot called pedal pulses? Okay. So you check for pedal pulses. So someone would have pulled his socks down. Now, I wonder how wet they were.
I haven't heard. Have you heard any? Yeah.
Nobody's asking the staff any questions. When things like this happen in the hospital, the directors go to court, not the nurses. Right. Not the lab tech person that did the blood draw, the director of what would have happened. Dr. Rice, the ER doctor, was, well, we would have done this, we would have done that, and what we would have done. And then someone said, well, were you there? Well, we had a physician's assistant. God love physician's assistant. They're like helping, lower the cost of healthcare somewhat.
Yeah, I know, yeah.
But, they need to be up to snuff, and a lot of them are, but some of them fly through by the seat of their pants. So someone could have put those back on in a hurry after checking his pulse, just to try and keep him warm. Another theory I have is he was getting ready to go to the morgue. Okay, pictures were being taken, families waiting to see him. Maybe they're being allowed in because they're family of a cop. Who knows if they were watching? But the big toes get tagged for the morgue.
Oh my God! Yeah.
As well as a wrist and a thumb. There's different policies elsewhere, but both big toes get tagged with the name, date, their birth date, and their death date, and the time of death. So somebody might have been polite and rushed those socks on. So whoever else was coming in to say goodbye didn't see the morgue tags. Often we'll get the morgue bag under the body, put a sheet over it. I can still smell that vinyl. Ugh. But you put a sheet over the body so the family doesn't see we're waiting to take the person to the morgue. Another option is it was an oversight by the police. They just didn't think about the socks. Or it could be nefarious. There was hair on the bottom of the socks. Like dog hair. That would hide the dog bite. Oh, yeah.
Yeah.
A German Shepherd sheds. There would have been hair on the bottom of his socks. Even if he was out in the snow with one shoe on, one shoe off, there would have been transference. Just like I've seen tar. I could tell on my bike accidents, my motorcycle people, if they wiped out on cement, if they wiped out on tar, or if they took a tumble into, if they got lucky onto some earth.
That was me.
Yeah. And I'd see that in their wounds. And, I would have my tweezers pulling out whatever I could to make the wound as clean as possible. And there's patterning, like Dr. Russell was so eloquently trying to say what was interrupted about, patterning to what type of polycarbonate pattern there is. If it breaks, very rare anyone's ever injured from polycarbonate. Ever. Now,
what would it do to soft? And we have about 7 minutes left. Actually,
did you see how thick it was?
What would it do to soft tissue? Because
poke
obviously
it would poke it and scratch it, but not so deeply. It was too thick. I'm
not sure it would break it though with soft tissue.
It would scratch, but
really?
Not like the scratches he had, not parallel and not that deep. Some of those scratches were going to need sutures.
Yeah.
Did you see those abrasions?
Yeah.
Some of them were going to need sutures.
Yeah.
Yeah. They would have had to clean those up. That would have been a dog wound exception to the rule.
Yeah.
So, and the jeans, I want to put another rumor to bed, and I know a lot of people aren't going to like this because they like the thought there was a fight and someone ripped his jeans. I sew. The triple hem top of a jean pocket is one of the hardest hems to get scissors through because my daughter and her friends used to like little blue jean purses. Okay. So if you look at that picture I sent of the jeans,
sure,
you can clearly see those were medically cut. And I want to know who the F asked for that phone and wallet, whatever he had, to come out of that pocket. Somebody demanded from a paramedic that pocket be cut. If you pull up that jeans picture, you're going to see one cut and the start of a second cut. Somebody asked for that phone. And that's why when I watched the trial, I'm like, why are they being funny about it being under him? Why are they saying his phone was under him? His phone was under him. I sensed a lie like I would with my patients. They'd have an entry wound that was within 18 inches, DJ, and they'd say they were on the front porch, was like 50 feet from the street. And I would tell my patients, are you serious? Do you have a short front lawn? Is it 18 inches or less? This person was facing you, and they're going to come back for you. Are you? And they say, do you want the Bible now? Because the police are on their way. You're either going to need to confess or do something. Move. I mean, and they were surprised at my bluntness. I mean, I really cared about these people. Like, get out of the street life, or you're going to be the 60% that comes back in a year going to the morgue. Don't make me tell your mama that.
Okay, and which was the photo we wanted to see?
Jeans.
Okay, with stupid, smirky.
Yeah.
There he
look,
is.
I want you to look at the corner where it would have been ripped. If those were ripped and not cut, it would have occurred at the right. That was cut. That's a triple hem. That was not a pull from a fight. That was scissor cut. And it was to not damage something in his pocket. Done on the far right.
That's interesting because a lot of people speculate that could have been he could have been.
Do you see the two cuts? Bea, look.
Yep. I see it.
Those are scissors.
Yeah, I see. Yeah, I mean, you could see right there where it was scissors.
And I know that
it wouldn't have. Yeah.
The people in the Free Karen regroup they don't like to hear that because it doesn't fit the narrative of a fight. To me, it's more nefarious. Jen or Carrie asked for that phone.
It doesn't matter. It is what it is. It doesn't matter if it fits, if it doesn't fit. We have experts like you to call what they see. And if you don't like it, that's, sorry, but obviously if you rip this, there probably would be more fraying.
That's what I'm telling you.
Than what there would be here. That you can see that looks like someone took a scissor and
the corner
cut it and they
of the
got
pocket
offline
is
there.
where they get ripped in scuffles, and I've seen that. The corner of the pocket when they're worn. That was a scissor cut. But why didn't any of the paramedics come out and mention anything about it? These are the things I would consult
because
with
they're
my
dishonest.
husband's.
Yeah. I just read or excuse me, I didn't read. I listened to a podcast about a Chicago enforcer for I'm trying to remember the name of the crime family there. And this is in the 80s. He ended up.
Sorry.
Oh, yeah. I'm going to have you answer her question in a second. He ended up becoming a fireman, EMT. And during his EMT rotations, he said that routinely he would have police ask him to change his report. And he would do that because, he's at heart, he's dishonest. Let's face it. He's a mob enforcer. He kills people. And then on the other hand, he had cops say he had a cop completely drunk driving, hit and kill a family in a car, and was like, hey man, you got to change your report. We can't let this guy go down for this. So this is not unusual that they would have gotten a hold of, found out that Caitlin Albert was friends with one of these idiot firefighters, McLaughlin, and then tell her to change her report. Let's get to Valhalla Law because we need to close the show. It has been 1 hour.
One more thing, or the socks were given to Peggy. So someone could have given the socks to Peggy. That's another.
Sure, you would think the keepsake. Sure.
Mm-hmm. Okay.
Question for Andrea: what level of medical expertise might a person need to guess how lethal his head wound was? Well, let me repeat that. What level of medical expertise might a person need to guess how lethal that head wound? So she's talking about.
I would say Brian
layperson.
Brian Higgins would have known enough through their job and experience and hearing about wounds and murders at houses and they had yellow fluid dripping out their ear. They would know that's a bad sign. So enough expertise to have enough hearsay to feel that was lethal. I've seen people leak CSF and come back and do well if we treat it in time, if we get to it in time. John's injuries, if this helps anybody, the man wouldn't have lived. He did not feel or consciously know of anything. The outer cortex had no neurons synapsing, no dendrites, neurons, no synapsing. He didn't feel anything. And when I saw his friend, I get the chills with in the audience all the time on his side with the red hair, and he was on the ID special. I even sent him a note on Twitter saying if it gives you any respite, just know that he did not feel anything after that fall, because the brain doesn't have a nerve of pain, and the skull does not have a nerve of pain. The skin does, but the skull and the brain do not have a nerve.
There you go. I mean, we've got, this is the best medical expert that we have had the honor to have on the show, and that of course is Miss Andrea Pfeifer, who reached out to me at the behest of the cat lady. I don't know.
Yeah, thanks, cat lady.
Yeah, the cat lady is our new mod, and she's really helping a lot to find great guests like yourself. And
thank you.
Yeah, Andrea, I'm going to say it was an honor to speak with you. Bia, what you got to say to Andrea?
Well, thank you so much for, telling us and just giving us another perspective, a medical perspective, and just another option of how this could have happened. So
It just breaks my heart for everybody, and it really does. The O'Keefes, my heart breaks for them too.
right. And
I don't hear you.
No, yeah.
that he didn't suffer. Oh, sorry.
Yeah,
I'm
he
glad to
didn't.
hear that he didn't suffer. So
I
that
think
actually
all
gives
this-
me a little peace.
I think it all happened under 2 minutes, including the dog attack on the arm. And unfortunately, he fell backwards either into medical weightlifting equipment or something hard. And I think in 10 years we may find out the truth.
Right.
God willing.
Thank you.
Yeah, it was an honor to have you on, Andrea. I'm gonna go
Nice
get some.
meeting you guys. DJ, take care of that knee.
I am. I'm gonna
so
go
nice
get something to eat, get some ice on my knee, get a couple meds going, and and settle in for the night. But I'm so glad that I didn't want to miss this, and that's why I wouldn't have done a show tonight. But when we got you, I decided, okay, yeah, we'll do a show because we got a medical expert. So I'll be speaking with you. We'll have you on again. You could find her on Twitter at Andy School. ANDY, is it SCHOOL?
Yeah, that's because I had 4 kids coming home under 7 with different levels of education. I felt like I was running Little House on the Prairie. So I just when I joined YouTube, I made it Andy School because everybody they had their own little education station. So you're there. 4 pairs of shoes and socks out the door, toothbrush. I felt like the Grinch in the morning.
I love it. We could do more people in the chat. First of all, let me thank everybody that showed up tonight. You guys are awesome.
And to the rewatch.
Yeah, and I want to thank the mods, all the mods that were here, and obviously the official lawyer of Calling All Beings, Valhalla, and of course the cat lady. And like I said, we could do more, but we're gonna have to save it for later. So on behalf of Miss Andrea, this is DJ saying peace out, one love, and we will see you down the road.
Namaste.
Namaste.